So yesterday down south, the smoke was sure thick. The air quality advisory continues up north. What does all of this mean for our health? As we've also been hearing, we're expecting, unfortunately, a bad wildfire season all across this country. And so we're going to have to understand how to deal with it. Dr. Christopher Pasco is with us, Assistant Professor of Physiology and Pathophysiology, specializing in chronic respiratory diseases. He's also a team member of the U of M's Air Safe Research Center that studies the impact of unsafe pollution levels like wildfire smoke. Good morning.
Good morning. How are you?
I'm well. So can you talk about the air quality warning that we saw yesterday down south, where we continue to see today down up north? What should people consider when smoke is in the air like that?
Well, you should definitely consider limiting your time outside to only necessary tasks, especially if you've got lung disease, things like asthma, maybe chronic obstructive pulmonary disease, you've got a cold, little children, the elderly. And if you do have to go outside, then it's best to wear one of those N95 masks, dust it off from our time during the pandemic, because it will help protect you from some of the particulate.
What are the actual physiological impacts of wildfire smoke on our bodies? Could you remind us?
Yeah, so I think everyone needs to remember that, wildfire smoke isn't just gas. There's these small little particulates that's suspended in the air from the burning wood. And these particles are about 30 times smaller than the width of your hair. So they get deep in the lung, they get lodged in there, they cause damage. They can make things like asthma worse. So we see that people with asthma, people with chronic disease, they end up in the hospital more frequently. They require more medication. They can make colds worse. And then you mentioned some of the work we're doing here at the University of Manitoba, trying to understand whether these things are actually causing disease themselves. We know that people who are exposed to them when they're young might have worse lung health later on. Whether they get asthma, still kind of unknown. But there are certainly both what we'd call acute, immediate effects, where it's harder to breathe, you get a cough, it makes disease worse, but also potentially long-term effects of this that we'll see 10, 15 years down the road.
Will people feel it right away? I mean, it's one thing to walk out and smell the smoke, and then you kind of almost get accustomed to it. Or are you more likely to be outside in this and then go inside after and say, wow, I can feel this in my body now?
Yeah, I think it might depend on the person. I know I was out yesterday, and the short amount of time I had to be out, I certainly felt it almost immediately. But you may not notice it if it's just, you think, oh, if it's just my asthma flaring up, or, it's a bit difficult to breathe, but of course it is. There's smoke in the air. But you certainly would see some of these effects linger throughout the day, especially if you've been outside for a while.
What's the impact specifically on children as their bodies and their lungs are developing?
Yeah, so our lungs are one of those organs that continue to grow as you age, right up until about the age of 20. And so as kids are exposed to this and their lungs are being damaged, it can stunt the growth, make it harder for them to get full breaths in, develop diseases such as asthma. It could make respiratory viruses worse. So we already know that those damage children's lungs as is. And then also not just children, but pregnant individuals who are expecting. There's some evidence that if you're exposed to this wildfire smoke while you're pregnant, your kids are also more likely to develop things like asthma and lung diseases later in life. So we do know that you want to try to limit your exposure, especially for those in the vulnerable populations.
Now, we obviously have spoken before about the impact of wildfire smoke. Last year was a terrible season, historic across Canada, and we felt it here in Manitoba. But this is different because this is burning like Cranberry Portage is our neighbors, right? So this is our province. Does it make a difference in terms of when you think of the amount of particulate in the air? Because the air quality is bad last summer from wildfires outside of the province, but this is right in our backyard.
Yeah, I certainly what we saw on Sunday from our own backyard is probably some of the worst air we've had recently, and that would make some of these effects worse. But sometimes the fact that it comes from a further distance away and the air quality might not be as bad might make it even worse long term, because we would go outside when maybe we wouldn't, and we'd be outside doing things for longer than we otherwise would on a day like yesterday. So certainly higher levels of particulate would be worse. But for the long-term effects, high levels of particulates from wildfires across the country are going to be a problem
as well. And what should we understand about the scale of how these things are measured when we hear the air quality is bad? How do we have a sense of how bad?
We like to compare it to pictures what we've seen in places like Beijing and New Delhi, where we have these large smog warnings when we say that the air is as bad as riding a bike down a busy street in a populous area like Beijing. But it was really hard to compare things like wildfire smoke and the density of it to things that we know. You look outside, you can't see the sun, or it's this ominous red orb in the sky. Um, and sometimes the best analogy that I've seen is comparing it to the number of cigarettes. It's like smoking, and the air quality that we had yesterday would have been like smoking 2 to 3 cigarettes for every hour that you're outside in it, which is maybe a bit more tangible of a thing that people can understand than this particulate that's suspended in the air.
So yesterday, if people had their windows open or they were outside, or how concerned should they be, and what's the advice moving forward?
Well, monitor your symptoms, especially if you've got chronic lung disease, and obviously speak to your doctor or go to the emergency if you feel like you're having a hard time breathing. Um, Going forward, the best thing you can do is keep your windows closed, wear a mask if you have to go outside for long periods of time. You can get air filtration devices. You can go pick them up, filter the particulate matter out of the air, make sure that your filter in your house is replaced and cleaned so that you're inside an environment that has a controlled air quality. If you do have to go out, then limit your time out there and try to get inside to fresh air as frequently as you can.
All important things worth repeating. Thank you so much, Dr. Pasco.
Thank you.
That is Dr. Christopher Pasco, Assistant Professor of Physiology and Pathophysiology, specializing in chronic respiratory diseases.